Good afternoon, everyone, and welcome to this Back to Basics session and also legal update specifically focused on the COVID workplace risk assessments. We are going to move fairly quickly through some of these areas because I do want to focus specifically on the workplace risk assessments and what this means for agencies. We have supplied information for you to use, but it is something that agencies, particularly from an HR compliance space, need to be across in terms of what it means for their agencies and how they can actually manage these requirements moving forwards. So let's just jump straight in. What do we mean by this and how does this actually work? So essentially, we are seeing a push right across Australia from the pandemic and emergency management laws directly onto work health and safety obligations for agencies, and that means more compliance obligations focused on the HR space. And what we mean by this essentially is that there are new rules, new assessments that agencies do need to consider in how they actually manage their vaccination requirements for staff and also focusing specifically on the recruitment of staff in this space and what it means for them as well. As always, we pay our respects to the elders past and present upon the lands on which we all meet. While this session is being run by webinar and recorded, we do pay our respects to the traditional owners accordingly. So our recommendations are quite simple. Review the COVID risk assessment and also look at the vaccination policy document that is available on Gemba and avoid obviously penalties through meeting your work health and safety obligations as well too. If you have any questions, by all means, reach out to us on our either directly on our chat line, or you can email us at support@gemba360. And specifically, because this is a specific legal update, by all means, please contact us either on the 1300 number or me directly on the mobile number directly. So what does this mean? Essentially, where we're going at with the COVID legal requirements from a back to basics requirement is looking at the risk assessment template. And we will come back to this specific document at the end of the session. But essentially what it means is that all workplace health assessment of all workplaces need to look at a risk assessment template for their agency. It is something that we flagged 6 months ago, and it is now coming into effect right around the country. So let's have a look at the overview briefly of the laws. I'm going to move through these fairly quickly because I do want to get to the risk assessment template and show you where that is on the Gemba dashboard. So essentially, what we have seen is that National Cabinet has and continues to review isolation requirements and also specific requirements for anyone that is COVID positive. So essentially, they're no longer mandated for positive cases to remain in isolation for up to 5 days. So what does this essentially mean? Well, if we focus, and let's start in Tassie, because this is where we've looked at the workplace assessment tool from, essentially that it means that in Tasmania, there are no longer requirements under the Public Health Act for any workers to be vaccinated. It means, though, that a workplace may require employees to be vaccinated to attend work if it has been identified that it is a reasonable measure to implement workplace COVID risk assessment obligations. So what does this mean? Well, essentially, you will see that in Tassie, there is still the mandated vaccination in high-risk settings, and this is for particularly workers that work, for example, in Aboriginal and Torres Strait Islander communities under NDIS, working with people that are elderly or frail, and also within the NDIS space as well too, as examples. It also means that choosing to require vaccination for employees now is actually sitting with the individual agencies to make this assessment. The same is said for in Victoria, where they have classified workers into categories A, B, or C for mandatory vaccination. And again, they're pushing it onto workplaces to actually look at individual workplace assessments. The same is happening in New South Wales. And again, while their orders have changed, there is now directions for workplaces to essentially undertake their own workplace assessments. If we look at Queensland, again, COVID-19 vaccination is no longer required for healthcare workers in primary care, private hospitals or private allied health services. But again, workplace assessments are being pushed. In WA, we're seeing it from the 10th of June. This is going back a little while, that again, mandatory vaccination policy will only apply to workforces working with the most vulnerable to protect them from severe disease. South Australia, we're seeing the same thing. And again, separate, it's highlighted separate from the government mandated vaccination requirements. Some employers have been implemented their own vaccination requirements. So what does this mean? Well, essentially, if we look at the workplace, and this is just a sample, it's not every workplace has an office type building. So whether you're a community service based agency providing outreach work, the concept idea is just shown diagrammatically here. That clients, personnel, and people returning to work, you do need to look at your vaccination requirements. Now, what does this mean? Well, from a workplace risk assessment tool, essentially what you've got, and we've got the document that is also available in a Word document for yourselves to be able to access as well too. You can see that here, and if I bring it up here for you, it is a document that has been circulated around to your agency to be able to use. Now, if we go back to this, and it is designed as a work instruction and a Word document, someone just asked us, can we change the details? Absolutely, you can. You just need to search and replace, and you've got a document there ready to go if we haven't already supplied it to you. Now, what this means is this. Essentially, let's have a look at Table A, Table B, and Table C at how this works. So if you are recruiting somebody, and you may have, and I can see there's questions already bumping through, and a few agencies asking us, well, hang on, what happens if we provide more than one service? How does this work? Great question. So essentially, if you're recruiting somebody, and we're going to use this as a recruitment tool, that you're looking at a new position. So if they are working in an outreach service and providing services to the community, let's say they are working in an Aboriginal service, and you are going to look at recruiting a person to work in your agency, and you're not sure whether to have them as a mandatory vaccination requirement. So under column on the left-hand side, we're going to start from here. So the source, risk, and factor. Describe the transmission. Well, essentially, you could put it in, and this is all just free text fields. So essentially, what we're looking at here is we have a face-to-face staff member that's going to work face-to-face and with clients, providing outreach work as well too in a vulnerable community. And let's say it is an Aboriginal and Torres Strait Islander community. So we've described the transmission in terms of how it could be. Now let's assess the risk of likelihood, and we do that from Table A. So we can see that now we assess the likelihood. So in this case, I'm going to say, well, the probability of work activities, it is face-to-face, and other factors causing significant transmission. Well, if they are working face-to-face, well, with clients that are vulnerable, well, the source of transmission is high. Now let's then go ahead, and we can put high in here, and let's assess the risk. So if we assess the risk, we get the consequence from Table B, and we can see the Table B here. Now, the consequence is that there could be significant impact to our agency if the transmission occurred, because if the worker is COVID positive, or I can see somebody just bounced up, what happens if the client is COVID positive? Correct. So in this case, the client could be COVID positive, so the risk of transmission is high. Now, the gross risk rating is calculated from Table C, and this is all in the work instruction that you have access to. So if I look at Table C, it has high and high from my two tables in Table A and B. So the gross risk rating is high. Now, of course, from an HR compliance point of view, you don't want to have a high assessment being done. So what's the mitigating controls that you could place in here that will reduce this? Well, in this case, I could say a couple of things. One is that we're going to get the client and the staff member to wear face masks if they are working in a vulnerable community. Someone has also just mentioned, well, could I also ask the staff member to be screened? Well, absolutely. You could do a self-assessment tool. And again, if I go back to my Gemba dashboard, the COVID risk assessment tool that you see up here, here it is here, it's coming up. And I can actually ask them to mark off these criteria questions to say that they've got whether they've got any presenting with any COVID symptoms. And I can go back and actually ask them to do the COVID risk assessment tool. It is something that a lot of agencies are still absolutely using for exactly what I'm talking about here. So that could be that we're then monitoring the COVID symptoms. The other one was obviously around vaccinations that we have. Now let's leave that till last here. So if I mitigate those controls, we've got them to do a COVID assessment on the staff member and the client. We're also showing that they're wearing face masks and they're social distancing. Now let's go in and reassess the risk. Now, if I look at table A, and I'm going to look at the next column, well then I've now probably of work activities and other factors causing some transmission. Yeah, I'd probably say that's moderate. And if I go to table B again too, yes, it could absolutely it's still high because it still could impact our business if transmission occurred. Now, if that was occurring, then my risk rating from a moderate to a high would still give me a high risk rating. So I could have it where essentially we could make the assessment and we could say in these circumstances, that if we don't, and I can see a few questions coming up, what happens if we don't have a workforce? Can we actually provide these services? And it is a real problem at the moment. So in this circumstance, you could say, well, we're going to put in all the other factors, all the other mitigating controls, except vaccinations. Now, if that was the case, you could essentially manage that to a moderate or low transmission. And some people have said, what happens if we actually increase the social distancing well beyond 1.5 meters? We've got air conditioning, we've put in the other control measures. Can we then also screen staff as part of this? If you decide to go ahead and do that, then you could drop the rating down to low or moderate. It is an individual assessment that needs to happen at the agency level. And from here, your workplace risk assessment means now that you potentially can have streams of staff, of some program staff, for example, that may work in corporate, that may not need to have the vaccination because they're not providing direct services to clients and the risk of transmission is low. It could also mean that they're also using hand sanitizer and the likes in your agency, depending on what the risks are. So essentially, you can make that different groups and program areas have different workplace risk assessments, and it is something to also consider. So with it, that's where we are focusing on for this Back to Basics training session. I do suggest you do look at your Gemba dashboard and access these resources, particularly from the Back to Basics session. More than happy to stay online and answer any questions that you might have. If you are watching this recording after today's live session and have any questions, then by all means, please reach out to us on 1300 360 360 or email us at support@gemba360.com.